Good afternoon, everyone. This is Rob O'Dell of Wheaton Partners from the Naples, Florida office. I want to welcome you to today's webinar, Making Sound Medicare Drug Plan Decisions, featuring Maura Carley of Healthcare Navigation. What I want to start with, before we get started, is do some house cleaning. This is an exciting topic for me to be able to have Maura here to speak on. How I met Maura was about a little over a year, not quite a year ago. One of her representatives called on me, and for those of you who are familiar with Wheaton Partners, we're very big in fee-for-service consulting, and Maura's organization does exactly that for health insurance and healthcare matters, and she can maybe talk a little bit about what exactly some of the other services that she has. To give you a quick introduction on Maura, she is the CEO and President of Healthcare Navigation, LLC. She has a master's degree in public health from Yale University. She's a fellow in the American College of Healthcare Executives and certified insurance consultant. With her today is the Director of Client Support Services of the Bonito Springs, Florida office, Sarah Gravlin. She is a graduate of Upstate University. Oneonta? Oneonta. Okay, cool. Very cool. We're excited to have you here. Thanks for being here.
Thank you.
All right. Let's begin. Medicare. And let's just talk about healthcare coverage in the United States. Why does Medicare appear to be more complicated than the other programs that are out there?
Well, Medicare is just more complicated now because it's been around for decades, and every piece of major federal legislation tends to affect it in some way. And we don't want to discuss all these, but are just illustrating over the years. And these laws are major pieces of federal legislation. So let's just go to the next slide. And I think it's
so. Yeah, let's talk a little about that. I was having dinner Sunday night with a person, and they do not have Medicare Part D. Should everyone have Medicare Part D, or if you're healthy and you don't take medication, should you not have it?
Well, we think everyone should have drug coverage. Some do not have to be on Part D because they still are fortunate enough to have good retiree medical, but that's becoming a rarer benefit. But we feel that the cost of drugs is potentially so ruinous, everyone should have protection.
You know, maybe before we get into Part D, maybe we should take a step back and just talk a little about Medicare A and B. I see it's almost as old as I am, 50 years old. Can you sort of review a little bit about the Medicare system overall?
Yes. We're going to try to address topics of interest to those who aren't quite yet on Medicare, as well as those who are already on it. So if you need to be on Medicare, then you should be on Medicare A and B, and then you have choices between Advantage plans, referred to as Part C, and you have Part D, which is the newest part of Medicare and covers outpatient prescription drugs. So you have, this is right from the Medicare New Book, this graphic depiction here. So original Medicare, people don't tend to think of themselves on original Medicare, but you're always on original Medicare when you enroll in Medicare, unless you've enrolled in a Medicare Advantage plan, which you have to actively do unless an employer does it for you, but there's someone taking action to get you on an Advantage plan. Otherwise, you're always on original Medicare, which is A and B, started in 1966, and then your decisions in original Medicare are a Part D plan. That came much later, 2006, and usually a supplement. We would recommend a supplement. There's a number of different choices, but there's important benefits in a supplement, but they aren't, supplements aren't Medicare products of any sort. They are individual insurance policies one buys to supplement Medicare A and B, and the term Medigap is totally synonymous with a supplement. The alternative to original Medicare, and you still have to be an A and B, is to elect enroll in your Advantage plan, and most Advantage plans include Part D, but not all, We've got the chart for you later. So usually if you join an Advantage plan, you're just enrolling in that plan. But some people have to enroll in the Advantage plan as well as a freestanding.
So a lot of combinations they could have.
Yes, but these are the two basic combinations. A third would be those in A and B still enjoying retiree medical through a former employer.
So I know the appendix list, I have it here, and I know a couple of the people are just getting to the point where they're getting ready to sign up for Medicare. So someone new to the Medicare system, what are some of the things they need to know?
Well, we're going to just talk about this very briefly because we're assuming most of the audience are already on Medicare, but for those of you who are not, the fact is that the government only takes care of people in terms of sending them their Medicare card automatically if that individual has elected Social Security before age 65. If you're getting your Social Security benefit prior to age 65, Social Security sends you your Medicare card, enrolling you in A and B, and that gets you started. You still have other decisions to make, but that gets you started. Everybody else has to actively enroll in Medicare. So if you're around 65 and you're not taking Social Security yet, then you have to enroll. It's easier than it used to be. You can go online to ssa.gov and enroll in Medicare, or you can always go into a Social Security office. Those people who have active group coverage working beyond age 65 can choose to not enroll in Medicare and keep their typically large group plan. They have a special enrollment period associated with their loss of group coverage or their retirement, which are typically pretty close to one another, but the clock starts with whichever event comes first. And that's a different process where you have to get something signed by the former employer. The general enrollment period, although it's described fairly benignly by government materials, it's really, no one should plan to enroll in the general enrollment period. It's designed to be punitive, and it's just to provide an alternative route to people who didn't handle the initial or the special enrollment properly. They can still get on Medicare, but they'll probably pay penalties and have a gap in coverage.
Okay, let's talk about Medicare Part D. And before we do this, we're going to have a couple questions going out to the audience, to listeners today. And Lillian, would you put up poll question number 1? And the question is, how many people listening today are on Medicare Part D? And we'll get results back to you shortly here. There's a poll is open. And again, if you go to the bar that I mentioned at the beginning, you can answer the question there, and we'll have results for a little later. So let's talk about Part D. In what situations could cause someone to enroll into a new plan, Part D?
Well, this is the time of year that you should be considering that, because 2016 information is just coming out. But let's just back up for just a second. This is a tedious slide, and I just want to say we're happy to email this PowerPoint to anyone who would like it. Some of this is a little redundant. If you enroll in A and B and you're staying on original Medicare, you usually want to get a D at that time. And then this slide goes through all of the situations where you should be on D. Frankly, some people still have an old supplement from years ago that still has some drug coverage. You know, Part D coverage is better than that. So, frankly, about the only people who don't need to consider being on D are those people who still have that retiree medical. But what we haven't talked about yet is the fact that Part D, although it's a government benefit, is managed by private companies. Many, many, many plan choices. I know we've got 19 in Florida for 2016 and 25 in the Chicago area. So for some people, that's almost too many choices, and you see some providers offering 2, 3, 4 plans. So, but let's move on to the next slide.
Well, what problems do people face if it's not handled correctly?
Well, just like that slide we saw about not getting onto Medicare properly, it's totally analogous to not getting on Part D properly, or maybe I shouldn't say properly. I'm very biased that everyone should have drug coverage. But we meet so many people who've never enrolled in a plan, typically because they say, I'm not taking any prescription meds, or I'm only taking a couple of cheap generics. But in our view, you never know when you are going to be prescribed something that is expensive, and drugs in the United States can be very expensive. But the fact is that the system is structured with this annual open enrollment period, which is why we're talking now. It's every year between October 15th and December 7th that you can make a new choice for January 1. So you could be without, I mean, we just met someone the other day whose grandfather hadn't enrolled in anything. Of course, he's been able to enroll since 2006. He can enroll this year for 2016, but he'll pay all those years of penalties. And they're not as severe as the Part B penalties, but they are lifetime penalties. Wow. So you can, I mean, the Medicare New Book says it more nicely than that. It says you will pay these penalties for as long as you were on Medicare, but you are usually on Medicare for the rest of your life. So you really should try to understand these enrollment issues and get on a Part D plan when you should, without a gap.
Sure. So what does Medicare cover, or Medicare Part D cover?
All right. Again, Medicare Part D didn't start until 2006, whereas the other part started in 1966. So there was a huge gap in coverage for those on Medicare. And so I just want to say there are many detractors of Part D, but before Part D, good retiree medical was more prevalent, and you could get some drug coverage in a supplement, but it was really a gaping hole in financial protection. Part D largely covers pills, tablets, and injectables. If you have a drug, like a chemotherapy drug that's infused into your body, then that is still under Part B, B as in boy, and there are still some expensive chemotherapy drugs manufactured as pills that were grandfathered under Part B. But for the most part, pills, tablets, and injectables, and we're talking about thousands of these. If you look at this middle bullet here, every plan's formulary is the approved list of drugs. And my colleague Sarah was just honing in on the Florida area earlier this week, and she looked at the plan with the least generous formulary, meaning list of approved drugs, and what was the spread between that and the most inclusive formulary. And it was 1,000 drugs. It was 1,000 drugs. So the least generous had just under 3,000 approved drugs. The most generous had just under 4,000. So not all of these Part D plans are the same, even though they're regulated by the federal government. Let's talk about how Part D works. It is a very strange benefit design, and the reason is because there was a feeling in Congress we can't do everything for everybody, so let's give people a little benefit at the beginning of their benefit period and protect them from catastrophically expensive drugs. But in the middle, if you go on this donut hole or into the coverage gap, you do pay much more. Now, we just got the 2016 figures. So for 2016, for most plans, you're either going to have a zero deductible or 360, but there can be some minor variations in that. But once you meet your deductible, you're in your initial benefit period with pretty decent coverage, where if you're using the pharmacy, you're just paying your copayment until what has spent on your drugs reaches $3,310. That's both what you paid at the pharmacy and or through mail order, your portion, as well as what your plan paid when that claim was submitted to them. Now, before the Affordable Care Act, when you were in that coverage gap, you paid the entire cost of the drugs. The Affordable Care Act got involved in Part D, and there's sort of pros and cons to this. The pro is that there's discounts now, more generous for different types of drugs, but there's discounts for drugs in the donut hole, and since you don't pay a discounted amount, that's a good thing, and you also have that to give you credit toward the catastrophic, which is $4,850 for 2016. But the disadvantage here is the plans felt this was foisted on them, and so this is probably the part of Medicare that has the most hassles, and this added to the hassle factor because historically drug plans were pretty much three-tier copay structures, and now you find 4 tiers, 5 tiers, 5 tiers in a specialty tier, and much higher copays, many more drugs being dropped off the formulary, which is all why it's so much more important to be a well-informed consumer as you shop.
Now we have the results from the first poll question. 50% of today's listeners are on Medicare Part D and 50% are not, whether they didn't enroll or they're not that age yet or for some other reason. I want to ask the second poll question to the audience, to the listeners here, is, in fact, Lillian, if you want to open the polls here, is how did you select your coverage? How did you select your coverage for those 50% of you who have Part D? So the polls are open. Please vote. Vote only once. Unless you're in Chicago, you can vote more often. And at this point, we're going to keep moving along. I'll explain that later to Sarah.
I get it.
Speaking of Sarah, since she's a millennial, she's going to take us out to the web and show us how to select, or how do you go about selecting coverage. And
I am. Okay.
Okay, so
Okay. Afternoon, everybody. So when we look at how to select a plan, you can go right to Medicare.gov. We have the link here. I'm going to do that. Medicare.gov/find-a-plan. So we're going to go there. And I'm basically going to do all the things that are bulleted here. Okay, so the first thing you do is enter in your zip code. I'm going to use Naples. If I can get this to move.
it's done.
Can you help me?
Sure. Second.
Okay.
It did not take right, I don't think.
Didn't take the first digit.
4103.
Yeah.
Positive. I have a little problem with the web here.
There
we go.
Okay. Okay, so then you're going to enter your information. This part isn't, the easiest way to do this is just select Original Medicare and then say, I don't get any extra help. Extra help is for lower income people, which probably doesn't apply here. So we're going to say continue to plan results. Now you enter your drugs. Okay, I'm going to just do a couple. So in saving of time. Okay, so it'll pop up whatever you type in, a couple of varieties of it, and then you're going to go in and select exactly what it is you use or as close as possible. And then you're going to add the drug and dosage. And we're just going to do one more. You can also browse. I mean, I think typing it in is just the easiest. We're just going to go with that. And if there's something, and it does ask you, do you want to use the generic, do you want to use the brand? We're going to say brand, because they always want to push you to generic, but some people won't do it that. And if you're going to just take a note of this over here, your drug list ID, password date, if this is something you're going to look at a couple times and you have multiple medications, when you log into this system again, you can put that up there and it'll pull it up for you, so you don't have to do it over and over again. Now you're going to select your pharmacy. We're just going to go to CVS and continue. Now, this is going to ask you, essentially, it's kind of hard to interpret, but this asking if you are selecting a D plan or do you want to look at Advantage plans. Right now, we're going to say prescription drug plans with original Medicare. That's Part D. This down here are Advantage plans, which we'll talk about later, but right now we're just going to look at these. So now the system is going to give us a list of the 19 plans in our zip code and how much these are all going to cost. Now you can notice here it says, are all your drugs on formulary? No. So I'm just going to scroll through it. Does anything say yes? No, it doesn't. So I'm just going to select a couple. You can select up to 3 to compare to see more specific information. And I'm just going to select the first 3. And then compare. Okay. Oops. Now you're going to see it's going to give us all kinds of breakdowns here. And this person is unfortunately on some expensive medications. It's going to tell us what's the monthly premium, is there a drug deductible, what's the cost of our annual enrollment, okay? And then it's going to break it down. You can see it's going to tell us if we're in the donut hole or not, which this person will be. But then I'll tell you a really great way to look at it is to say print comparison report. If you want it, save it. But here is where we really look. So under drug coverage information, this is where you're going to know what kind of restrictions do you have. What is the breakdown of these medications? You can see that Androgel, unfortunately, is not on anybody's formulary. For Lavazza, there's 3 different things that you want to look at. Is there step therapy? Is there quantity limits? Is there prior authorization? For this, it looks like there is step therapy. Now, step therapy is something you want to try to avoid at all costs. That's where, as Maura would say, essentially you're allowing the drug plan to tell you what you can and can't take. So for this step therapy, this gentleman would have to first be prescribed something different and cheaper by his doctor, prove that that failed before he was allowed to have the Lavazza. So maybe for him, he wants to go for this plan. There's no restrictions, which means there's no prior authorization, there's no quantity limit, there's no step therapy. This would be easiest for him. And which plan is this? And we'll wrap it up. The Medicare Blue RX. And it's pretty reasonably priced. So we'll bring it back to the slideshow, but that's essentially how you do a drug review.
Great, thanks, Sarah.
You're welcome.
All right, let's talk a little bit more in depth about the key issues that lead you to select a plan. No, we can go back to the previous slide. As Sarah said, there are rules associated with these plans. So we discussed before the formulary. is clearly extremely important. Are your drugs covered? And what you're trying to find is a plan that does cover them all. Otherwise, you're getting no value from that coverage. Then these other issues like the rules are important to a lot of people. Quantity limits, most of us are used to. We just have to be careful about how we request refills. Prior auth is not a huge impediment, but it does require work through your doctor's office. So as Sarah said, seeing no restrictions is a signal that that will be very easy to get my drug filled, no problems. But step therapy at the other extreme is what people tend to find so distasteful. Now, you will read in the newspaper every year that shopping according to premium is what you should do, and that's not really true. You should look at total projected out-of-pocket expense. However, you can take this to silly extremes because none of us know what we're going to take next year. So we also want to say your main objective is to get on a reputable plan where all your drugs are covered with the least rules, and you don't want to consider changing plans for very modest savings. Most people on Part D are having the premium withheld from their Social Security checks. Of course, if you're not taking Social Security, that's not the case. But if you are and you change Part D plans, and think about it, millions of people are doing this at this time of year, then when you change, Social Security has to stop paying one plan, start paying another plan, and that can just, again, be something you've got to track and follow up on for several months. It's not the end of the world, but you really don't want to subject yourself to that unless the savings are substantial. Obviously, if your plan has changed its formulary and drugs you were on are no longer covered, that is a main motivator to change. And, you know, the Part D plans in existence from year to year don't remain the same. We've got 4 in this area, for example, we're in Florida today, that are getting out of the marketplace. Usually you have to shop for a new plan. Sometimes the plan will put you in something else. So,
and this time of year is when people are thinking either signing up for the first time or evaluating, do they change your plan or not? Is that correct? Is it
right.
Once a year?
October 15th to December 7th for C and or D. Normally, you get on A and B, and you stay on A and B forever. The only time you'd get on B and off is if you were on Medicare and came out of retirement, for example, and had active group coverage through your work or a spouse's. So when we talk about an annual enrollment, we're only talking about C and D. This is just a footnote here. There are some additional routes for people to largely have buyer's remorse with the decision they made in the fall to get on something else mid-year because you are, for the most part, locked in to your choice until the following year. I don't want to spend a lot of time on these because I truly believe everyone should do the best job they can getting on the plan that makes the most sense in the actual enrollment period, because when we've dealt with people with buyer's remorse or trying to find the 5-star program, if there is one in their area, supposedly you're supposed to be able to change easily. I don't think it is that easy. So make your best decision in the fall.
Okay. Well, let's take a look at, in fact, before we get to this next slide here, the poll is closed from question number 2 is how they selected their Medicare Part D. 40% of those on Medicare Part D on this webinar with us now, 40% was advised by an insurance advisor. 20% self-study, the other, and then other was 20%. So no one replied to an advertisement in a newspaper on today's webinar.
Huh.
Interesting.
Very good.
Well, since most of the listeners are in one of two areas, Illinois or Florida, we thought we'd pick on those two states. So this is Florida Part D. What are we looking at here?
We are looking at Part D plan choices for the Florida area in 2016. The good news here is you've got a lot of recognizable brands. That's always reassuring. But what is interesting is the spread, of course, in premiums. Humana Walmart in the middle of the pack, well, a little lower than the middle. A monthly premium of $18.40. That's low. And then you've got just 3 lines above that, Blue Medicare RX, option 2, a monthly premium of $174.70. So an enormous spread, which is why all of these other factors that we talked about are important in deciding, because you know what? Some of the more expensive plans in terms of premiums still are the best option for you. If you're not taking any medications and you have no conditions you're worried about and you're willing to go to Walmart, certainly that inexpensive plan is a great alternative as opposed to deciding not to have coverage at all, in our view. So this is a list of Advantage plans in this area. So where it says annual drug deductible and the box is blank, that means that Advantage plan doesn't include D. So as you can see, most of them do, but you have to know when you're enrolling in an Advantage plan, does it include D? If it does not, you need to also enroll in the freestanding D plan. And as you can see, the premiums vary here too. Usually a 0 premium plan means you've got many, many, many co-pays for services that you receive, and there's usually an out-of-pocket maximum for the year, and those vary. $6,000 something is a common one, $10,000, but again, you have to look at these plans. Should we look at Illinois?
Sure, and in fact, you just said something that I just want to circle back to you, is that for someone who's not on Part D or is not considering going on Part D, they might be best served by getting a plan, a bare bones plan, like the Walmart plan you just mentioned, so that if they ever want, they have more drugs in the future, they can upgrade to a better plan and not face a penalty. Did I understand that correctly?
That is correct, but one thing we haven't talked about today, which some people have said to me is, I don't want to pay my income indexed amount either. So let's just spend a moment on that. Part B as in boy became income indexed in 2007, and Part D as in dog, what we're talking about today, became income indexed in 2011. So if you have a greater income, you pay more. And income indexing starts at $85,000 for an individual and $170,000 for a couple. And for the Part D, the very fluky thing about it is that you can pay as much as $70 a month if you're at the highest income level for your income indexed amount. And so as you could see from what we just looked at, many of the premiums are below that. Mm-hmm. So it becomes more annoying, even more annoying, that I'm not taking any medications and have to pay this. But again, because of, we have one side of our business where we're helping people navigate a transition in their health care. The other part of our business is helping people navigate the coverage they have. And we see people with very serious illness spending enough on drugs in January, because mm-hmm. this process resets every year, January 1, to go to catastrophic. So yes, it can be burdensome to pay these premiums. Yes, it can be annoying to pay a premium and an income index premium and not have medications, but drugs can be so astronomically expensive. Now we're in Cook County now, or I guess these are for Illinois. The Advantage plan rates can be tied to a smaller geographic area. What's sort of interesting about this Illinois Part D plan option is that once again you see, for the most part, very well recognized companies, and there's been a bit of a shakeout over the past, 6. But of course, everyone should realize that Aetna is trying to acquire Humana, Anthem is trying to acquire Cigna. They're all players, and so that's another reason to keep watching this over the next several years. And here we have Cook County Medicare Advantage options. And again, look at Humana. 1, 2, 3, 4, 5, 6 different plans. So it's just a lot of options people have.
How often do you advise people to review their Part D plan?
We absolutely believe if you're going into the donut hole or think you might be, that you look at it every year, because often you see, as in the tool Sarah used, the 3 options were relatively clustered in terms of projected total out-of-pocket expense, but sometimes quite inexplicably you find quite a range. We had one client who would have spent $10,000 more on her drugs if she had stayed on her current plan, which is a lot of money.
That's real money.
We also think people should get a little familiar with that tool, the Medicare.gov Find a Plan tool, because there's nothing in the environment that suggests any more simplicity is on its way to the consumer. And just, most of us had group coverage our whole adult lives. Actually, I'm still enjoying that. But when an employer is providing you with coverage, you just don't need to be as savvy as you do once you're making all of these decisions with so many choices.
So let's talk about that. Say the viewers today, some maybe are good self-studiers, some are do-it-yourselfers, maybe some have a more difficulty with technology. Where should they go to find the right solution for them? What services are available? Maybe some healthcare navigation helps with.
Well, we certainly help people, but we are, like you, fee-based, so we're not aligned with any company and we don't accept any commissions, but the only way we generate revenue is to charge client fees. Most people can learn how to use this Medicare.gov Find a Plan tool, excuse me, and there are always local pharmacies and the area agency on aging. You can Google that, and there are organizations all over the country and nonprofits that are willing to help people with these decisions.
But I'm going to have Lillian put up poll question number 3, which is for those listeners today or those who are listening at another time, because it's being recorded today, if they would like to get more information on Part D from us. Also, we received one question in earlier, is will a copy of the slide deck be available to listeners? And the answer is yes. So contact Lillian and she'll make sure you get the copy of the deck of slides that you're seeing here. So the poll is open. If you'd like to have more information from Wheaton Well Partners on healthcare navigation, we would be happy to put you in contact.
May I mention one thing?
Yes.
I'm sorry, Maura Carley again. I forgot to mention, I've mentioned so often that Social Security does the enrollment for Medicare A and B. And sometimes it's helpful to think of the history of these programs just to keep it straight in your mind. But those are that started in the mid-60s. Advantage plans came much later. So you can enroll in an Advantage plan through the plan or through the Medicare.gov website. The same is true with D. You enroll through the Medicare.gov website or directly on the plan's website or call the plan. But these, again, you're never going to see Part D enrollment on your original Medicare card. It's going to be separate because that company did the enrollment. Okay.
Good. It's complicated. It is. The poll question that I actually put up there, Lillian put up there, I asked the wrong question. It was for future webinar topics that you would like to see. And if you don't mind taking a few moments and voting on this poll, we have Social Security as a topic for webinars, Florida residency, year-end tax planning, buying and selling luxury automobiles, do's and don'ts of international travel. In fact, you mentioned something about international travel and Medicare before we started today's program.
I did. Often we find people who don't realize that Medicare does not cover medical expenses outside the U.S. except in the rarest of circumstances, and that is you are traveling near the Canadian or the Mexican border or directly on your way to Alaska through Canada. You become urgently ill, and the Mexican or Canadian hospital is closer than the U.S. hospital. Now, Advantage plans can or cannot include, or may not include, a foreign travel emergency benefit. You really need to know. Supplements, we didn't talk about today, but except in passing, many of them have a foreign travel emergency benefit, but it's limited. It's a $50,000 lifetime benefit, and at 80% is $40,000 lifetime benefit. So if you're traveling, we think you should get travel coverage or count on using that $40,000, but make sure you have that $40,000. Make sure you have the coverage, because we get calls every year from people who thought Medicare would cover them outside the U.S. who thought, you know, these hospitals in various parts of the world don't bill Americans. That's a myth. This year we had someone who let his supplement lapse, and he was in France and was admitted to a hospital in Paris at a cost of like 5,000 or 6,000 euros a day. Wow. Total private pay. So it's a very important issue.
Well, that's real money. Yeah. Got a question came in here, and the question is, what is the difference between a basic and enhanced plans? What are the differences?
Well, usually the basic has a lesser formulary and an enhanced, broader formulary, meaning just the number of drugs that are covered by that plan.
Okay. Well, good. Now, the Medicare Part D consulting that you do is just one piece of what you do for clients. Can you maybe just give just a quick overview of healthcare navigation and some of the services you provide and to individuals,
sure,
both retired and not retired?
Right. Well, we have two very different lines of business. One we call non-subscription, but it's really consulting or a project. It's an engagement that comes to an end. And the most common type of engagement is a coverage transition. And there's so many events in the United States that separate us from our coverage. You know, our children turning 26 and losing a job, moving to another state potentially, divorce, retirement, going on Medicare, death of a spouse. So all of those events, and of course annual enrollment. I mean, we're facing that in the individual throughout the country very soon as well. And then the other side of the business is very different because it's not a short-term engagement. We have clients who are subscription clients, and they're at different levels depending on their needs, but basically are their authorized representative to handle whatever they want us to handle for them. A couple of categories, we're managing everything. So they don't look at a claim or paperwork or make a phone call for prior auth. At a more basic level, we're still the representative, but, you know, for example, for all of those clients, we'd be doing a Part D review every year.
Okay, good. Well, we're going to have you back in the beginning of December or end of November, we haven't set an exact date, to talk on a different topic. And the topic's going to be individual health insurance. And for those who are maybe recently laid off, what should they be looking at? And can you maybe comment a little bit on that, what we can look forward to?
Sure. Although we don't really know. You know, the Affordable Care Act did dramatically transform the individual insurance marketplace in 2014. And so there's so many issues now because benefit design was changed by the Affordable Care Act, and also pre-existing conditions for non-Medicare coverage went away. But the Affordable Care Act also made certain benefits unlimited that had been limited before. Before the Affordable Care Act, you might buy a policy with $1 million maximum or a $2 million maximum. Unlimited was becoming more rare, but now so many of these benefits are unlimited, so it's meant higher deductibles, although you have different tiers, but so you have a choice of deductibles, but in general, we're looking at plans with higher deductibles, narrower networks, and in New York, that's probably the most extreme example where in the individual marketplace there is no out-of-network benefit in the individual marketplace. But the point of this is to say, since 2014, when all this began, the premium information that's been submitted to departments of insurance for their blessing has been based on assumptions rather than claims data, because the whole system changed January 1. So we're still in for a bit of a ride the next couple of years, both because we're still in the midst of this total transformation of the individual marketplace, and we've got major players, Aetna acquiring Humana, Anthem acquiring Cigna, and some people getting out because they're making money, and others jumping into the marketplace to make money. So it's still quite chaotic.
Kind of Wild West in the healthcare.
And you know what? We don't know today what 2016 options are. Open enrollment starts November 1st. It was originally supposed to start October 15th, according to the legislation. It's been moved back for political reasons, but I'm hoping some information becomes available in October about 2016 options, but if it's like last year, it didn't become available for the most part until the day open enrollment started, which this year is November 1. So you've got a very short window, November 1 to December 15th, if you have individual insurance for a January 1 effective date, and probably everyone who has individual insurance should be looking at it again because it hasn't stabilized. There are areas of the country, Chicago's certainly more stable than many others because Illinois Blue Cross and Blue Shield is such a dominant carrier. But
well, we'll definitely look forward to having you back, and hopefully we'll know something before November 1st. But that webinar, the date has not been selected yet, but it'll be likely at the end of November, early December, at least 2 weeks, hopefully 2 weeks before the closing of the enrollment period there. So thank you, Sarah, Laura, for coming in and doing this webinar. Really appreciate it. It's been very beneficial. And the last poll question we're going to put up there is if you want information on today's webinar, hit yes or no. The polls are open for about 1 more minute before we sign off here. And again, thank you so much.
Oh, you're welcome.
For being here.
Welcome. Delighted to be here.